Hello everyone, my name is John Delali Yekle, a final year student of All Nations University Koforidua. I'm presenting my project on the topic Design and Development of a Special Tool for Efficient Flowmeter Attachment and Detachment. This work is supervised by Dr. Mercy A. Watma. Medical oxygen flow meters are vital for controlling oxygen therapy in Ghana, especially during cases of emergency where oxygen is needed to control the patient's breath. However, spanners and drenches are commonly used to attach these flow meters to the cylinders. The continuous use of the spanners or the drenches causes a delay to the oxygen supply. Aside even that, the hexagonal nut which holds the oxygen flow meter to the cylinder also causes wear or tear due to the continuous use of these common tools. Again, the continuous use of these tools can also lead to operational defects and increased costs. Health workers also face tool misplacement, physical strain, and inefficiencies that hinders emergency response and patient care. So this project addresses these systematic challenges by designing a more ergonomic and efficient specialized tool for quick, safe, and durable attachment and detachment of oxygen cylinders. This specialized tool has four main parts. We have the handle, the screw, the nut, and the bolt. For this process or for this specialized tool to be designed, we have the conceptual potential solutions where we have the T-knot type of specialized tool for attaching and then detaching. We also have the knot type of a solution mean to resolve this solution or this problem. Also, we also have rubber spanners, and then from this point we have links or rubber tube links, and this is the specialized tool. But for all these conceptual solutions, we realize that this device, the specialized tool that we've designed, has a lot of advantages. It can be opened 180 and even more to 270. The T can only be opened 90 to about 210 degrees, and then the knot, this can also be used, but will also have the same effect as the spanners and then the drenches also cause. With the tube that can link the oxygen cylinder and then the flow meter together for oxygen delivery, it can also be used, but in some cases the more they use or the continuous use of this device can also cause a loose at the tip or at the end of the links. So this device has much potential or has a lot of advantages that can be used. So if you look from this aspect, these are just the dimensions and then parts of this specialized tool that were under process. We have the 3D, the top, the side, and then the bottom view of the device, and then their measurements or dimensions. So after putting all these dimensions together, this is the final image of the specialized tool that we have. So from the key facts that we are having here, we can see we have the handle, we have the screw, we have the bolt, and then the nut. So this is where the nut is being opened, and then the bolt is taken off, and this becomes the holding part to the oxygen cylinder. So this part is attached to the oxygen cylinder, and then the nut is closed again for a firm hold, and the handle is held. Either you rotate it anti-clockwise or clockwise to take off your oxygen flow meter from the cylinder. So our vision, the vision for this project is to develop a specialized tool that will be used for quick, safe, and durable attaching and then detaching of oxygen cylinders, oxygen flow meters to their cylinders. It will also analyze the wear course of flow meter knots. It will also design, or we are also having a vision of designing a prototype and a durable ergonomic tool that will save the hospital for frequent spurs of oxygen cylinders and then the flow meters replacement. Also, we are going to evaluate this tool's effectiveness via or through a survey that we'll be conducting and then a test as well. So we'll be conducting a survey where questionnaires will be sent to each hospital and each environment for them to fill and then check the durability, the safetiness, and then the easy usage of this specialized tool. So we have some technical descriptions of this specialized tool that is being designed and developed. So we talk about the usage, the portability, the durability, and then the time consuming. So if you look at from the mode of assessment, we also have the outcome. So after the questionnaires were sent out, we realized that the outcome of each this mode of assessment turned out to be positively, meaning that the usage is very easy to use. It has no much side effect as in causing harm to the person's hand or difficult to handle or heavy. It is lightweighted, so we have it to be ergonomically designed. And then portability is very easy to handle. A child, an adult, fat or small person can also use it. Then its durability is something that is made out from a wood. It's just painted with this color that you might think is metal, so it doesn't rust, but rather a wood. That is what we use for it. Then for time consume, it is very fast. You need just about 30 seconds in just opening the knot, and then after tying it to this, is very easy for you to use. So in conclusion, we are suggesting that this device, specialized tool, should be replaced with all the current tools that are being used at the hospitals that are causing the hexagonal knots to cause tear and knot, and then making oxygen leak, operational delays, and then causing much harms to the patients. And in conclusion, we will say that the device is very easy to use and then should be adopted in all hospitals as well. Thank you.